I'm going to go ahead and introduce myself. I am Dr. Ron Hunninghake. I am the president of the Reardon Clinic in Wichita, Kansas. Dr. Hugh Reardon was the founder, and the Reardon Clinic was set up in order to understand the functional underpinnings of chronic illness. And so where Dr. Reardon developed a worldwide reputation was in his 10-year research project looking at the root causes of cancer. And one of the breakthroughs that he made was using intravenous vitamin C as a treatment for cancer. But obviously, it's more complex than that. And so what I have done in the current lecture is to try to understand how intravenous vitamin C fits into the appropriate care of the cancer patient from a holistic perspective. And Dr. Reardon was one of the early orthomolecular doctors, and I'll talk to him about that in my presentation. So that's why I have called this particular presentation the Orthos 14 Concepts, Caring for the Non-Healing Wound. So I'll try to present this as concepts to help you kind of pull together what it is that makes this unique compared to conventional medicine, which I refer to as pathos, looking at the pathology. Orthos is looking at the whole picture in an attempt to understand the root causes of the illness, because obviously cancer is a very complex illness. And so I'm a medical doctor, been at the Reardon Clinic for 37 years now, and have learned a lot. And I'm very grateful to Dr. Chang, for helping set this up. And I'm hoping that we can have more dialogue in the future as well, because these are all the rise of chronic illness in the world is it's crazy how sick people are getting these days. And the conventional approach of just treating the symptoms, it's not going to cut it. We have to look for the root causes. And so that's what this presentation is about. So let me go ahead and jump into it. So what I'm doing is basically sharing with you a conceptual model of a new way of doing cancer care. And that will involve 14 key concepts that I will try to enlarge on in my slides. So I'm defining cancer as a non-healing wound, and that will be explained in greater detail. So our goal with cancer patients is to heal the wound of cancer. So here are the 14 concepts, just to give you an overview. Orthos oncology. Let's just start with that. Orthos is taken from the word orthomolecular. So this is an orthomolecular perspective on cancer care. Ortho means the right or the proper. So we want to get the right molecules in there in order to help the body heal. So the goal of this presentation is to outline and create a different, hopefully more effective way in not only understanding what cancer is, how it behaves, but also to outline a more effective non-toxic treatment methodology for cancer patients. So Orthos, as I said, it's the abbreviation of orthomolecular. What I'm looking at is a systems repair process, that focuses on the cellular dysfunctions that are feeding the cancer cell growth. So the basic idea is to repair what I call redox stress and restore redox balance. So here's redox stress, and through a repair process, redox balance or redox life can be achieved. And this will help with the restoration of the cancer process. So here's a picture of Dr. Hugh Reardon, and his quote is, "We don't treat cancer here, we treat patients who have cancer." So again, in conventional thinking, the target is the cancer, kill the cancer. Reardon looked at people as a whole person, whole environment, nutrition, stress, all the various aspects that go into a patient's life. All of these factors can be related to the genesis of cancer. And if we don't address them, the roots of cancer will not go away, and just killing the tumor may not heal the illness. So, and Dr. Reardon was not the only guy that was working on this. There's a number of pioneers, and I won't be able to go through all of these, but I knew most of these people. They obviously, some of the James Lind and St. Gorgie, who was credited for the discovery of vitamin C. These are long gone pioneers, but they were tremendous humanitarians. They focused on people as much as they did on molecules. So Orthos takes into consideration the whole person dimension of cancer as well as the molecules. So you really have to have both dimensions in order to promote true healing. When we start thinking about the disease of cancer, there are many, many root causes, and you can take some time and study this slide, but these are all, chronic inflammation, obesity, sedentary lifestyle, weakened immune system, poor diet, stress, insomnia, smoking, alcohol, environmental toxins, overuse of pharmaceutical drugs, nutrient deficiencies. All of these things play into setting up an environment in the body that makes cancer possible in that particular person. These are root causes. So now we're back to this term orthos, oncology. So the opposite of orthos is allos. So allopathic medicine is basically using a medication to fight the manifestation of the disease. Allopathic. Orthomolecular is using the right molecules to help the body facilitate a healing process. So looking at this, we really do need both. We at the Reardon Clinic, we obviously are orthomolecular in our foundation, but we're trying to use more of an integrative approach. We now have 3 integrative oncologists on staff. They are naturopaths, but they've done special training in oncology, and they are applying an integrative approach, which is really a bit of both. It's allos plus orthos. So obviously, if you've got cancer, you do have to do these things: remedy the disease, determine the grade and stage, kill the cancer cells, and you're looking for a longer survival time. But that alone has not really turned the tide in the trends of cancer. So by adding this adjunctive care, orthos adjunctive care, look at the whole patient, search and correct underlying causes, do things like IVC that strengthen the healthy cells, regulate oxidative stress, work on quality of life, lifestyle things. All of these are adjunctive things that can give a better outcome to chronically ill cancer patients. So that was the first concept. Now the second concept, cancering. Cancering. Rather than thinking of cancer as a noun, and it's a tumor growth, but it's a process, and it's where some degree of wounding in one of the organs gets so bad that it can't heal itself. It becomes a chronic wound that shows up as what we call cancer, the non-healing wound. And the hallmarks of cancer is a step in that direction. It's an attempt to understand what are the underlying cancering mechanisms. So if we can figure out what the dysfunction is, then we can work on improving that function, healing the process by identifying and correcting root causes. So in a book by Dr. Naisha Winters, it's called The Metabolic Approach to Cancer. What she has done is identified 10 terrains within the body, 10 terrains of cancer causation. Now, this diagram, which I will not have time to go through in general, but it's very interesting. In her 10 terrains, one of the key ones she discovered in working with thousands of patients, she's been doing this for over 30 years. She's a 30-year cancer survivor herself. What she found is prolonged psycho-emotional stress was almost always a key factor. And this kind of chronic stress can cause a cascade of consequences throughout the body that results in the non-healing wound. And so these are things that you don't hear about in conventional oncology because this is a long-term process. Cancer doesn't just happen. Matter of fact, we know that almost everyone has cancer cells, but the immune system controls the growth of those cells. But when these protective mechanisms break down under the weight of chronic stress and nutrient depletion, toxins, all those things that we've already mentioned, that's when the cancer can emerge. The guardrails are off. The cells that have started to go into cancer now begin to proliferate out of control. So the first person to really use this concept of cancer as a non-healing wound was actually Dr. Reardon's son, Neil Reardon. And Dr. Reardon, his son, Neil, he basically wrote an article along with Xiaolong Ming, who was one of our key researchers during the RECNAC research project from 1990 to 2000. And so they wrote this article, Cancer is a Functional Repair Tissue, that actually the idea is it's a wound, but it's trying to repair itself. But the wound itself can be comprised of many different types of injuries, physical, chemical, biological, and emotional, or so-called mind-body injuries. And as long as these factors persist, the wound may not heal. And I'm going to go into the deep biochemistry of this, but this concept is a good way to look at why cancer is a non-healing wound and what we need to do to bring about more of a healing process. So in the research program, RECNAC, which is cancer spelled backwards, the idea was to reverse the trends of cancer. So in this research program, a lot was done looking at cytokines. Cytokines are regulators of the growth of cancer. And what we found is that there were, out of this review of 174 cytokines, they were what was regulating apoptosis, inflammation, angiogenesis, atherosclerosis, the body's response to injury, the non-healing wound. And so basically what was found is that there was a tendency of the body to upregulate the heal the wound type of cytokines. And these were called oncogenes. So they are really oncogenes are really heal the wound genes, but that's part of the cancering process. The cancer may actually be an attempt on the body's part to take an area of the body that's very sick and try to heal it. And so the healing the wound, those cytokines go up. Turn off healing, those cytokines go down. So this is a very interesting finding. Then we found that one of the really key findings, that if you give high dose intravenous vitamin C, 25, 50, 75 grams of vitamin C, even one IV vitamin C would dramatically shift the cytokine activity to more normal. So you could take these, you could find 22 cytokine categories that were improved after a series of IV vitamin C infusions. So thinking from a molecular biological model, cancer is a redox model of wound healing. So here's another paper looking at what happened on vitamin C, on the effect on cytokine production. And just in general, you can see that the inflammatory cytokines go down. So high dose vitamin C is effectively an anti-inflammatory agent that reduces the cytokines that are driving the cancer process. So here's the next slide. So what I'm basically proposing at a biological molecular level, cancer is a redox model of wound healing. So what does that mean? A redox model. So this Dr. Nadeau wrote an incredible book called Redox Life. And basically, if you put it in real simple terms, life is electron flow. And if you disrupt that electron flow, you get disease. And I'm going to go into this in quite a bit more detail. So Irwin Stone, one of the early pioneers in vitamin C research, he said, on a molecular basis, the whole living process is nothing more than the orderly flow and transfer of electrons. We are electrical beings. Our cell phones, they're electrical beings too, but we interact. We can touch the screen. We have an electrical force around us and in us, and everything is electron flow. So what I'm going to do now is kind of convert this kind of abstract idea of cellular redox and wound healing into a simple model. And so keep in mind that healing is a symphony, and basically when we are well, we are adapting. Then injury comes, toxins, infection, stress, any number of things. So when the injury occurs, the body recognizes that and sends us a repair signal. There's a signaling process, and then repair hopefully occurs, and then we're back to adapting. And a lot of this happens at the level of the mitochondria. So let's go more into that. So adapting is balanced redox. Injury is where that balance is disrupted. That disruption creates a signal of increased oxidation, and that initiates a process of repair that we call inflammation. And if the redox life processes are working properly, healing will occur. And most of life is all about it's just happening. We're healing all the time. We're getting sick and injured, and the body adapts. Hopefully we eat the right foods, we take care of ourselves, get enough sleep, and we heal. But in cancer, that process has broken down. So redox stress is chronic injury. So it's chronic injury, like smoking. that's a chronic injury to the lung. Not getting enough sleep, or excessive avoidance, or excuse me, excessive exposure to certain toxic environmental toxins. This is chronic injury. And so we want to call that redox stress. We have a lot of redox stress in our world. This chart, once again, you can take your time and look through it. There's lifestyle stress, there's social stress, environmental factors, and a whole bunch of miscellaneous stressors. And so all of these things trigger this adaptive response in our bodies. And this is just external oxidative stress. This is what's going on outside of us. What about on the inside? So on the inside, our organelles, and especially the mitochondria, are constantly exposed to internal oxidative stress, imbalance of homeostasis, fatty acid metabolic abnormalities, oxidative phosphorylation impairment, gene problems, mitochondrial gene problems, inflammation, reactive oxygen species, exacerbated insulin resistance in terms of diabetes, just for instance. All of these things create internal oxidative stress, external and internal. So we are under attack, shall we say, all the time, and the body is adapting all the time. So when we look at all this, we can start to see that oxidative stress can actually deplete good electron flow. And then various biomolecules when we have electron depletion, it results in dysfunctional cellular signaling here. And hopefully, if we can heal that wound, we'll do something to restore normal electron flow. But if the oxidative stress is unrelenting, redox stress, then you'll start to get dysfunctional cellular signaling, and that becomes the basis of all chronic illness. So dysfunctional cellular signaling is my concept for number 5. So, now, not all oxidation is bad. Obviously, we need oxidation for immunity. Our lysosomes can make hydrogen peroxide. We need that to destroy invading bacteria and viruses. We need oxidation to generate energy. The mitochondria oxidize glucose in the Krebs cycle. So that's helping us create energy. So that's good oxidation. Bad cellular oxidation is when we have an overload of free radicals, and that can set up a chain reaction that can damage cell membranes, the mitochondria, organelles within the cell. The DNA can get damaged by excessive oxidation, and then this results in what we call degenerative disease: cataracts, macular degeneration, coronary artery disease, autoimmune, rheumatoid arthritis, and cancer. So cancer is probably the big one that we're focusing on, but all of these chronic illnesses result from an overload of bad cellular oxidation. So that's reactive oxygen species, ROS. And the SOS is good. These are proper signals. When we get an SOS, the body responds with good oxidation. Reactive oxygen species, if we get too much of that, that's where we get into chronic illness. So this is a balance point. So if things are good, if we have good, what I call redox reserve, then the intracellular milieu has good oxygenation. The NAD to NADH ratio is good. We have abundant ATP, water, nutrients, antioxidant enzymes, healthy lifestyle choices. This is health. It's a reducing environment. And oxidizing environment is where stress, aging, poor oxygen utilization, NAD depletion at the mitochondrial level, metals, toxins, toxic metals, poor food, malnutrition, unhealthy lifestyle. All of these tend to tip us in the other direction. So we go to the next slide. Well, what we're talking about here, if we're healthy, we've got good redox reserve. It's a yin and yang here. Okay, right? And so, but if we've got too much redox injury, toxins, that depletes electrons, sustained redox injury causes cellular dysfunction, multi-organ injury dysregulates our life-sustaining function. So this is chronic illness, basically. So redox injury is where the scale is tipped. And now our cells are living in a wounded cellular environment, the chronic wound, the non-healing wound. And it's all based upon a dysfunctioning of the cellular milieu. It becomes more oxidizing than what the body can correct. And this is SOS. It's a signal there, and hopefully there is a signal from these different organs to try to repair the problem. So this is just to take a little break here. We've gotten down here to the number 6, dysfunctional oxygen utilization. So these are some orthomolecular concepts. Let's keep going here. So what ends up happening here is dysfunctional oxygen utilization. Dysfunctional oxygen utilization. Now this next graph is kind of complex. But basically what I want you to focus on, this is that same model of illness, is where you get an injury, the signaling is not working properly, you get a non-healing wound, that's pathological, that's pathos. The repair process isn't working. And many times the big problem here is in cellular respiration and some damage to our DNA. So why is this happening, and what else can we do about it? So this is where I want to talk to you a little bit about the use, and we won't go into this in detail, but Dr. Frank Schallenberger, another associate of ours here at the Reardon Clinic, he's got his own clinic in Nevada, but he found that a lot of people who were prone to cancer had poor oxygen utilization. So you have to have oxygen in order for cellular metabolism to work properly. And so he found out that by measuring people who would come into his office, they looked healthy, but a lot of them had a very poor energy quotient. And that energy quotient is a representation of how well their mitochondria are using oxygen. You say, well, what's the big deal there? Well, it turns out it is a very big deal. That anything that decreases your oxygen utilization sets you up for early onset mitochondrial dysfunction. So decreased O2 utilization, you don't break down your fats as well. You don't process nutrients as well. Your thyroid functioning diminishes. You start to feel tired. Hormones get out of balance. Inflammation, insulin resistance, poor methylation. The NAD to NADH ratio is lower than it should be. So all of this sets you up, and you don't break down fat, you don't sleep as well, you're stressed, you're toxic, you're infected, and you develop ischemia at different levels. All of these things are root causes for you to be incubating cancer and other chronic illnesses. And it happens so slowly, most people, we call it aging, but it can happen to young people, people who are very young that are having all kinds of problems. This is early onset mitochondrial dysfunction. Okay, this is what's causing cancer, but it's taking a long time for it actually to show up as a tumor. So the common denominator here is basically an excess of ROS, reactive oxygen species. So it's basically oxidative stress at the cellular level, and that's due to dysfunctional oxygen utilization. And that triggers something called HIF-1 alpha. Stress triggers this. And I'm going to show you how this plays into cancer and why high dose vitamin C can be very helpful here. So Orthos, back again to our key idea, Orthos is where what are the things that we can do right? Orthomolecular is what can we do right to correct this? And a lot of this is lifestyle, choices, awareness, eating, exercise, sleep, relationships, detoxification. All of this is things that we have within our capacity to do. And it's not really in the conventional medical model. All allos is just, okay, we're just going to treat the cancer. What caused the cancer? Doesn't matter. We're going to treat the cancer. That's what we do as doctors. Well, a broader type of medicine is where we look for root causes and help people begin to identify those and make corrections in those areas. So it turns out that vitamin C level in the body is an important signal, a regulatory signal. So if we can, in order to understand the role of this HIF-1 alpha, we have to come to grips with the fact that ascorbate, vitamin C, plays an incredibly important role in this whole process. So I showed you this slide before. When you have poor oxygen utilization, that induces hypoxia induction factor, HIF-1 alpha, and that can be regulated by vitamin C. So this is a bit of a complex chart here. When you get an injury, and if you have inadequate oxygen supply, hypoxia, even if it's only partial hypoxia, that will trigger this HIF-1 alpha. Okay, right here. Hypoxia triggers this. And then there's a downstream effect from all this. This sets up a cascade of cellular responses that begins to move your physiology towards the cancer state with increased angiogenesis, cell proliferation, metabolic adaptation, and anaerobic glycolysis. All of these are steps in the direction of cancer. So as we know, cancer doesn't just, boom, happen like an infection. It's a process. And all of these things are triggered by reactive oxygen species. All of this basically sets us going in the wrong direction in terms of our health. So what finally occurred to me is that HIF-1 is upregulated in almost all cancers, and vitamin C can attenuate that signal. So this was a couple of studies, and basically, as your vitamin C, here's vitamin C, as it goes up, the HIF-1 alpha goes down. So vitamin C attenuates this signal. So if you give someone vitamin C, here's the temporal changes in the expression of the HIF pathway proteins following a single bolus of high-dose vitamin C administration in mice. It lowers that HIF-1. Now, if you don't keep giving the vitamin C, that HIF signal will go back up again if you haven't changed the environment of the body. So this is going to be a little bit of a complicated slide, but this kind of takes you through how HIF-1 alpha, how it's associated with low ascorbate, okay? And low oxygen and low ascorbate. So if you have mitochondrial oxidative stress, you're not able to oxidize NADH to NAD. Okay, and let's see here. Okay, so that slows the Krebs cycle. So you start making less ATP. You know, almost every cancer patient I know is fatigued. They're very fatigued. That then reduces your production of antioxidant enzymes, so your mitochondria cannot repair itself properly without the antioxidants. And then that develops into a P53 dysfunction. So normally, if a mitochondria is damaged, it will take itself out through the P53 pathway. But if you have no energy, you can't do it. And so, so basically, what vitamin C does, it's kind of like a signaling system. This slide. I'm sorry. This is kind of more of a concept, but it's the cell attempting to survive in a microcellular environment that is inflammatory and low in oxygen. So it's really an attempt on the part of the cell to survive. I won't have time to go through all this, but there's some very interesting papers on this, that maybe this is one of the reasons why our species, we used to be able to make our own vitamin C, but we can't make it anymore, because there was a time in the evolution of humans that vitamin C intake itself became a signal. Now we got past that stage, but now we're back to it in the sense that we really do need more vitamin C in order to stop this HIF-1 alpha effect. So that's something that we probably need to talk more about as time goes on. So maybe to help clear this up, let's look at a very interesting concept called the ascorbyl radical. We think of vitamin C as just an electron donor, but we don't think of it as a stable free radical. And so here's the deal. Every injury that your cell sustains triggers the production of what's called the superoxide. It's a single oxygen, but it's very short-lived. Same thing with nitric oxide. These are signaling molecules that result from electron leakage in your cells, in your mitochondria. It can cause other problems, and we'll talk about these, but in general, when these are formed, that's what converts vitamin C. This is the vitamin C molecule right here, vitamin C. That converts it into the ascorbyl radical. And in other words, an electron is taken by these the superoxide or the nitric oxide. So then you have this ascorbyl radical here. So what does that mean? What's the deal here? This is going to surprise a lot of you. Most of us think, okay, vitamin C is vitamin C. Well, here's the vitamin C molecule. But when it goes into solution, it becomes the ascorbate mono anion. And that can also go to the ascorbate dianion, but that's not very common. But here is the ascorbate radical, but this is it in the anion form. So you don't have to remember any of this, but one of our conferences, there was a Professor Gary Buettner from the University of Iowa, which, they're doing a lot of research now on vitamin C in cancer as well. But he's the one that first told me about the ascorbyl radical. Now, this is not a bad guy. Mostly we think of radicals as being bad guys. The ascorbyl radical is an essential component of normal cellular health. I'm going to go into that in more detail here. So what's interesting is that ascorbic acid, here's ascorbic acid on this side, on the left. It's obviously it's a as a powder, it's very stable, But when you put it into solution, it will go into this ascorbyl radical form. So, and this is called ASC with this extra electron. So unlike glucose, it contains this highly reactive combination of enediol groups. And this, where the cloud is an enediol group. This group confers upon the ascorbic acid molecule certain unique biochemical characteristics that explains its vital importance in a living process. It transforms an inactive sugar into a highly reactive labile reversible carbohydrate derivative that readily donates and accepts electrons. So this can donate or accept electrons from the surrounding media. This is known as an oxidation reduction system. I know you're going to be kind of confused with this, but let's go a little bit further. And so Dr. Thomas Levy, who maybe you're hearing lecture at your conference, he's the one that kind of this is the way to understand this. When you have this ascorbyl radical, it can either accept an electron or donate an electron. Okay? If it donates electron, it becomes dehydroascorbate. If it accepts an electron, it becomes this back to the ascorbyl radical again, the ascorbate. So anyway, it acts as a buffer, as an electron buffer in solution. So in the cell, it's constantly shifting around electrons. And so hopefully you'll get to hear Dr. Levy's presentation on this because he goes into this in quite a bit of detail. I'm just going to read this now. So Dr. Levy and his inimical way of looking at things, one day we were talking about all this, and here's what he said. He said it's basically because of its stability and its delocalized electron that the ascorbyl radical can either accept or donate electrons, and it's probably doing it constantly. It functions as an electron buffer in an inflammatory environment. So that's why vitamin C is so important, because otherwise, without it, we would be becoming oxidized. But vitamin C kind of shifts that around. It's constantly trying to help normalize this this environment within the cell, oxidative environment. So again, this makes the ascorbyl radical a bioxidant. It can go either way. It can function biologically as an antioxidant and mop up free radicals, modulate cytokine-controlled inflammation, but it can also help with the formation of healthy collagen, like if you're walling off a tumor. So there's a lot of different things that vitamin C can do for you. So here's another look at it. So in high dose vitamin C, this bioxidant property, it mops up large numbers of free radicals. It modulates cytokine-controlled inflammation. It promotes formation of healthy collagen. But it also, pharmacologically, it's a pro-oxidant that can generate the hydroxy radicals. So this can, we have catalase, and they can neutralize. This can neutralize peroxide, and then cancer cells that lack adequate catalase, well, they go into apoptosis. The cells that have catalase tend to survive, and the cells that don't, those cancer cells tend to not do so well. They can sometimes go back and regenerate their own apoptosis. So what vitamin C does, a cancer cell, if it's sick enough, it should take itself out. But if it's so sick that it can't apoptose, then it's going to perpetuate as a cancer cell. Vitamin C, one of the things that vitamin C does, if you give it in an adequate dose, and this is what Dr. Reardon found, is that if we give IV vitamin C such that the blood level goes up to the 350, 400 milligram per deciliter range, those cancer cells will die. So this is how you get selective cytotoxicity. And that's why it goes back to this unique ability of vitamin C to either take electrons or give off electrons. So he, to verify this dosage range, he had a prostate cancer patient who had stage 4 prostate cancer. He basically came in and using his own blood, we took his blood and we put it in a culture media, and cancer cells grew 100%. Then what we did is we gave him a 60-gram IV vitamin C, and at the I think at the 20-minute mark, we took blood from him and tested the blood level of vitamin C, and it was in this it was higher than 350. And at that level, that blood, then we put cancer cells on it, and there was no growth. So as long as the serum level of vitamin C was in this upper range, above 350 or above 20 millimoles per liter, no cancer growth. The vitamin C infusion ended, and then, of course, the vitamin C started to come back down. As it went back down below this line, you can start to see, and every 30 minutes we were taking samples, that the cancer cells started to regrow on those samples. So high dose vitamin C suppresses the growth of cancer cells. So this gets into an interesting topic about the non-rate limited advantage. There was a doctor here in the United States, Dr. Robert Cathcart, who found that you can keep giving vitamin C at higher and higher doses, and even at those doses, it will still act as a free radical scavenger, okay, which makes it unique. So he found that working with college students, they would come in with mononucleosis, and he could normally, if you take more than about 5 or 10 grams of vitamin C, you'll get diarrhea. But if someone's really sick, he could give them 10 grams of vitamin C every hour for like 10 hours. So like 100 grams of oral vitamin C. Most people, that would cause diarrhea. But with someone that was really sick, like with mono, the body would use that to mop up the excess oxidative stress, okay? And at the same time, vitamin C can regenerate glutathione, because, glutathione is an electron donor also, but it's very tricky to create. In order to create glutathione, you need all these cofactors to make glutathione. And so here's the cofactors. You need selenium, magnesium, zinc. And so these are rate limiting steps for glutathione. Vitamin C, you can just keep giving it as long as you give it, it's going to act as a mop up of oxidative stress. So that's what makes IV vitamin C unique. So these are all methylation cofactors, and you need the methylation pathway is how your body makes glutathione. But if you don't have enough of these cofactors, you can't make your glutathione. If you have enough vitamin C intravenous or oral, that'll continue to deplete the excess oxidation. So that's what makes vitamin C unique. So how do we get vitamin C into the mitochondria? Well, it turns out there are what they call SVCT transporters in the membrane of the mitochondria. The SVCT transporters, and they transport the vitamin C in. So there can be some problems with that, but generally speaking, vitamin C can help you with preventing oxidative damage due to electron leakage from faulty mitochondria. Okay, now we're going to talk a little bit, again, number 10 here, the hypoxic intracellular environment. So when the intracellular environment becomes hypoxic, that's where we start to see the Warburg effect. So with chronic tissue wounding, remember I mentioned that cancer is the non-healing wound. The environment, the microenvironment becomes inflammatory, and hypoxia in the cell goes up. And so what happens then is the cells will go into what's called anaerobic fermentation. If there's not enough oxygen, the cells will shift to fermentation pathway. And this is what Otto Warburg discovered. He discovered that the metabolism of cancer cells was anaerobic, and he got the Nobel Prize. But no one really knew quite exactly what that meant. So I'm going to kind of try to show you what I call the vicious cycle of cellular hypoxia, because I think this is the essence of cancer. And I can, hopefully you'll see again how vitamin C plays such a crucial role in fixing this. And so once again, if your mitochondria aren't working very well, you're not converting NADH to NAD, which is the key step in terms of mitochondrial energy production. So there should be about a 700 to 1 ratio of NADH to NAD, and a lower ratio means poor electron transfer. That's what electron transfer is, basically what makes that's life. Electron transfer is life. When that goes down, then your Krebs cycle begins to slow down as well. And so without the Krebs cycle, you're not going to be making ATP. Need ATP. So what happens in glycolysis, cancer cells, instead of making 36 ATPs per glucose molecule, a cancer cell is only making 2 ATPs, right? So it becomes a sugar hog. So that's why when you want to go ahead and do a PET scan, you're giving radioactive tagged glucose, and it's being taken up by the cancer cells because they're in glycolysis and they crave sugar, right? That's why a lot of cancer patients crave sugar as well. So when this is happening, your body cannot make enzymes very well, antioxidant enzymes. So like, for example, glutathione, like we were talking about earlier, you need a lot of energy to make glutathione. So what do? Well, you're going to get, now your mitochondria are going to start to leak. You're going to have membrane injury to the mitochondrial DNA. You're going to get mitochondrial oxidative stress. Your mitochondria aren't going to be working as well. They're sick. In cancer, you have sick mitochondria. And then they're so sick that they can't even take themselves out. Normally, in a good environment, if the mitochondria gets really sick, they take themselves out. Okay, it's the p53 apoptosis will take them out. But in this case, apoptosis is disabled. So the whole thing causes cells to drift in more and more anaerobic direction, hypoxygen direction. So when you are in an anaerobic metabolism, you're actually making less CO2 because, you make CO2, through the use of oxygen, right? And so that decreases your CO2 output. And you need CO2 to displace the oxygen from the hemoglobin. Your hemoglobin is delivering oxygen throughout the body, but if you don't have CO2, you can't displace it. People who are hyperventilating, they can't get enough oxygen. Well, because they're blowing off all their carbon dioxide. You got to slow their breathing down so they get some carbon dioxide, and then that will displace the oxygen from the hemoglobin, and then the cells will start to get better oxygenation. But in this case, this whole scenario, you have faulty oxygen transport. So in general, the body becomes more and more hypoxic. The cells become more and more hypoxic, and that induces HIF1 alpha. Remember, we talked about that. So the result of that is overall cellular hypoxia. And this whole thing is a huge vicious cycle at the cellular level. That's what cancer is. This is cancer. Right here, what I'm showing you is cancer. And that creates more and more progressive oxidative stress and reactive oxygen species. Okay. And we're stuck. So there's an amazing article in the orthomolecular.org journal written many years ago. I think it was in 1985 by Stephen Levine and Paris Kidd. Basically, it was the free radical hypoxia clonal thesis of cancer causation. That's last slide that I just showed you. That's what this is. You can read through this slide, but basically these cells that become hypoxic form clones, and they create a survival mechanism in a micro-inflammatory environment that it would otherwise not support healthy cells. The cells are human cells trying to survive, but the survival mechanism has gone amok. And so they can start to happen in little clusters, but if you get a big enough area of hypoxia, that's where you get into, that's where your cancer takes off. So as the level of oxidative stress occurs, the cells will try to divide more often, but as the stress gets higher and higher, you start seeing more apoptosis and necrosis, death of cells. And if you've ever seen a cross section of a cancer, the cells in the middle are all kind of dead. It's the cancer more on the outside of the tumor. So increased oxidative stress is what drives cancer, and it's all tied into everything that I've just been trying to point out. So what do we do? How do we approach this? Do we need to kill cancer cells? I mean, that's the whole idea of conventional medicine, is use very toxic chemicals to try to kill the cancer cells. And these chemicals will temporarily kill cancer cells and the tumor will shrink, but the medicines oftentimes are so toxic that they also kill the immune system, the natural killer cells. And so consequently, the tumors will grow back. And now without the natural killer cells, the cancer will then really take off. So most of the chemotherapies will give you temporary control, but all too often the cancer grows back. So what about a different thought process? What about thinking about the environment of the cancer cell? What else can we do? So here we are back to my model that we've talked about earlier. So if we take the position that our approach to cancer is going to be adjunctive care, orthomolecular care, what we want to try to do here is repair as many of the good cellular processes as we can. In other words, work on repairing the healing mechanisms and balance out the oxidative stress, manage the oxygen species, and try to reduce the number of reactive oxygen species is basically what we're wanting to try to do. So here's all of our reactive oxygen species, and this is all tied to methylation, sleep, hormones, nutrition, inflammation, thyroid. So this is why the holistic approach to the cancer patient is really important. And it's not an either or. If you can do really good holistic care and treat the cancer, let's do that. Get the best of both worlds. And so this is, we're back to now to what can we do? Improve oxygenation. This is why exercise is good. Replenish nutrient deficiencies, get that thyroid working again, balance the hormones, improve sleep, reduce stress, avoid toxins, treat infection, and reduce ischemia, get your exercise going, regulate your blood sugar, use the cofactors to improve methylation, improve mitochondrial functioning. All of these things will improve mitochondrial functioning. And then that, we're not necessarily just killing the cancer cells. We're actually trying to get, this is where Orthos comes in. We're trying to repair oxygen utilization. So again, Orthos is looking at this side in conjunction with this side. It's not an either or, it's a both and. It's integrative as opposed to being just one side. And that way we don't trap patients. Now, there are patients that don't want to do any conventional therapy that we'll work with them. But oftentimes when you're dealing with, especially an advanced cancer, you really need the best of both of these worlds. So we want to regulate both the internal and external oxidative stress. And so we're back to this model here. And there's a lot of things that you can do here with nutrition. I'm thinking of a person, Dr. Richard Cunyon, who was an orthomolecular doctor here in California. And he was a 25-year stage 4 prostate cancer survivor. He had cancer, but he survived for 25 years. And the way he did it was all the things that I'm talking about in terms of his nutrition, his exercise, all the various things. He was able to basically take the cancer and suppress its continued growth. And he did that by basically doing this, where he got all these various things that improves this signaling of oxygen species. So and I call this wise choices, to where you're balancing choices that you're making to help you reduce the reactive oxygen species. So SOS counterbalances the ROS. So this involves people taking control of their life choices. The very famous researcher Jonas Salk basically said life is an error-making and error-correcting process. And nature, in marking man's papers, will grade him for wisdom as measured by both survival and the quality of life of those who survive. So he wrote a book called The Survival of the Wisest. And so basically what that boils down to, this to me is the pyramid or the diagram for Orthos, which is process-driven, better self-care. Allos is remedy-driven, cancer remedies. This is processes that people can engage in, improving their oxygenation, managing stress, and improving their adrenals. Thyroid, there's a lot that can be done to improve thyroid functioning. Magnesium, vitamin C, iodine, vitamin D, this carbon dioxide issue, exercise, methylation, niacin, can have very powerful effects on mitochondrial functioning as well, because it's part of the mitochondrial process. Vitamin C here is right in the center. But also, working on digestion, working on detoxification, liver, getting your brain working better, heart functioning, exercise, oxygenation, all these things. Thymus, here is the thymus, your immune system. So this diagram to me represents Orthos, all the things that we can do to help our cancer patients survive better. So I'm going to go a little bit into now into melatonin, and then I think I'll probably be ending up here after this section here. So it turns out that melatonin, if you're stressed, you'll deplete your melatonin, and then you'll not sleep very well. And there's a lot of people, poor sleep is a kind of a starting point for a lot of health problems. So really what we want to do is help our mitochondria. And it turns out that there is a transporter that can also help you get more melatonin into your mitochondria. I'll just read through this. Melatonin's relationship to the mitochondria is more profound than previously believed. It is formed in the mitochondria. There are melatonin receptors there. It's not only synthesized in the pineal gland, but in almost all organs. The quantities of extrapineal melatonin exceed those in the pineal gland by orders of magnitude. There's a lot more in cells than what we realize. And this melatonin is not released into the circulation, so you can't measure it. What we measure in the circulation is from the pineal gland, but what's going on in the organs, that's hard to measure. But melatonin is one of the most powerful free radical scavengers. Can also prevent apoptosis, which I referred to earlier as being one of the factors that keeps cancer going. It downregulates nitric oxide synthesis. It reduces that nitric oxide free radical. It reduces electron leakage. It increases the level of antioxidants in the cells, such as glutathione. So melatonin, I think, is a really overlooked, powerful treatment. And I'm going to just show you another. There's a lot that could be said about this. I'm not going to have time to go into it. But nitric oxide can create this peroxynitrate, which is another very powerful pro-oxidant. So Martin Pall was the one that identified this very vicious cycle, and it's probably one of the reasons why we get into problems with chronic oxidative stress. If it's not controlled, it creates tremendous amount of nitrosative stress, which can affect your immune system, a number of different things. And here's what melatonin, when we're young, we have a lot of melatonin, but as we get older, we have less and less. So melatonin, in addition to IV vitamin C, this is one Dr. Levy uses it, but Dr. Frank Schallenberger uses a lot of melatonin with his cancer patients, and we have one of his lectures online, goes into great detail. Anyway, I think it's an underutilized treatment. So here's a number of studies about using melatonin in high doses with cancer patients. It definitely can slow the growth of cancer. Does all these things. And so here's what Dr. Schallenberger uses with his cancer patients is 180 milligrams before bed and 60 milligrams 3 to 6 times per day. And we've seen no adverse effects with that, zero contraindications. It's really very inexpensive and very safe. So I think at this point, there's a number, there's more to my presentation, but I think we've kind of hit most of the high points. There's a lot of different ways. Another area is fungal infections that needs to be talked about, mitochondrial dysfunction, the ortho-oncology hallmarks. You can study this, but there's a lot more that we could say. But I think I'm going to end there. The last section, the dramatic rise of pathos, basically just covers the fact that our world is under siege now from environmental toxins, stress, poor diet, people are not sleeping, obesity, exercise, they're not getting enough exercise, breakdown in relationships and family, you name it, we are under siege. And so this is basically putting more stress on our adaptive capacity than what we almost can handle. But the orthomolecular approach of using vitamin C, melatonin, magnesium, various nutrients, it's not the whole answer, but it does offer a safer, very effective way to help recreate this balance so that the tendency towards hypoxia in our cells begins to reverse instead of continuing to progress to where cancer is becoming a worldwide epidemic. Then you throw in long COVID, you throw in heart attacks, you throw in depression and psychiatric illness. We are living in a time of severe chronic illness. And so the orthomolecular approach can be, I think, very, very helpful as a way of people starting to focus on repair, the repair process, not just treating symptoms, but actually repairing our adaptive mechanisms. So I think there's more to this. I go in a lot into the growth of chronic illness in the 20th century. It's phenomenal, but thank you very much for your listening. And I hope this is at least giving you an idea that the orthomolecular approach can be used in conjunction with conventional medicine. It's not an either or. And it's an empowering way for people to begin to take better control of their lives and to live in a more healthy way that's scientifically we can show the mechanisms of why these choices are so powerful and how they can reduce risk of illness, but even more importantly, improve quality of life so that you get hopefully the best life you can. So thank you so much. I appreciate your attention.